Hi guys. So welcome to the second episode of Health Talk We Make Sense. Like we promised you guys, we are going to be giving you back-to-back content, right? And today we are going to be talking about something that is very, very important. So get a book, get a pen so that you'll be able to jot things
things
and take
down.
things away, right? So today we are going to be talking about are we in trouble as regards to antibiotic and anti-malaria resistance. So you still remember me. My name is Dr. MC, or my Instagram handle Dr. underscore table shaker, and I'm here with
Dr. Esther, nice to meet you.
Dr. City, nice to meet you guys.
all right. So today, like I already said, we are going to be talking about anti-malarial and antibiotic resistance. So basically, what is resistance? Resistance is just, I'm going to like describe it in a way that you'll be able to remember at each point in time, so that anytime that maybe you get to the hospital and maybe they tell you they are treating you for resistant malaria or something, you understand what they are saying. So usually resistance just has to do with the fact that this medication that usually would have worked for the treatment of a particular ailment is no longer working anymore, right? And there are different factors that can result in you coming down with resistance. Do you get? So today we are just going to be throwing light on basically a lot of things that we do that predisposes us or have been predisposing us to come down with ailments where our medications are no longer giving us the things that we have. I'm sure that most of us would have had this experience whereby, oh, you go to the hospital, they treat you, and maybe by the time you come back, you're still feeling very unwell, and the doctor says, oh, maybe you're having resistant malaria or something. So if you listen to us very well today, you're going to be able to help us stop the rapid progression of these kinds of occurrences, because this is the reason why we are having this conversation today. So basically, one of the things that happens is that Nigerians una no dey hear word. I'm sorry, but I need to start off this way.
Yeah.
Nigerians una no dey hear word, because I'm sure one way or the other you may have heard that, oh, this can cause this, but you will still see people that are still doing the things that they are not meant to do. Do you get? For example, I'm sure that I've told many patients that that is not everything that you need antibiotics for, because you know that Nigerians always feel like antibiotic is one wonder drug that cures everything, right? So it's not everything that you need antibiotics for. There are certain conditions that you don't need an antibiotic for.
Definitely.
Most of them, especially viral infections. There was even this point where there was this post by NHS, right, where they said that flus do not get better when you use antibiotics. Do you understand? So most of the times when you're having things like catarrh, cough, right, and you come and take antibiotics, whereas it's just a viral infection that you had, what you have just done now is that you're creating room for antibiotic resistance. Do you understand? So those are some of the things that we are going to be talking about today, so that we are going to share a lot of experiences, so that probably with that, because I feel like most people in this country like learning from experience instead of, or some people even want to experience it first before they will agree to what you said. Because there was this patient, that's why I said most of the time Nigerians don't hear. Like, I'm just going to talk about this, is going to like throw light to what I have to say. There was this woman that I was attending to one of the days, and she was like, oh, that her first child had cerebral palsy from jaundice that they did not treat properly, that they were telling her that, oh, that she should breastfeed this child well. Is it because of this small jaundice that you are coming to come and see the doctor? And eventually the child had kernicterus and came down with cerebral palsy. Do you understand? So she was now telling me that, oh, that after this experience, all her children now, anything that happens, she comes to the hospital. Do you understand? But I'm very sure if something like that did not happen to her, if you're telling her that, please, this, you need to do this, she will not listen to you. Like recently, there was this patient that I had. Her child had jaundice as well. So she had to stay like longer. You know, after delivery, you notice your child has jaundice, we want to start phototherapy for
Yeah.
you. Do you understand?
Yeah.
And I know that patients don't like staying. I don't even like staying in the hospital. It's just that I have to go to the hospital
I can
because it's
agree
my
with you.
work. Do you,
I can
do
agree with
do
you.
you understand? So, like, she was now trying to make it look like we are trying to keep her longer in the hospital when she did not require to stay longer. I wanted to start making a case, was shouting. I was still trying to explain to her that, madam, me self, na me dey quick discharge. If I feel like you don't need to be in this hospital,
It's less work for
you
me.
go home. It's less work for me. Do you understand? But
Yeah.
as it stands, your child has to be here, because if your child is not here, this can happen, and it will not be a funny thing to experience. Do you understand? So I feel like some of these experiences that we are going to share today are going to probably throw more light so that people have a way of
Yeah.
staying away
And
from
a
these
side
things.
note, because before we forget about this jaundice of a thing, antibiotic does not cure jaundice, except sepsis is like the presupposing factor of the jaundice. Because most African parents, once they see their child's eyes beginning to be yellow, the next thing that they get
Is ampiclos that they
ampiclos or Zinat.
It's always-
Zinat that is
yes,
going now.
Zinat now don't dey reign now. So
Yes.
either they are taking ampiclos or they are buying Zinat.
Yeah.
Yes.
So we first of all, when a child has jaundice, they have to be a cause. Some of them is just physiological. It
Yes,
just
physiologic
happens.
jaundice, yes.
Some
Because
of
of their
them, it might
livers
be
are
that you're not
still
breastfeeding them well,
Yeah.
or they are reacting to your breast milk, or that they are all actually have an infection.
Yeah.
But it's when they visit the hospital and some investigations are carried out, then they will be able to know, okay,
what exactly
what is causing, or it might be your blood group is not
ABO incompatibility.
thank you, or a rhesus factor
Yeah.
problem. So don't just see your child's eyes is yellow and go and buy ampiclos or Zinat.
Is that exposing a small child to antibiotics that
oh
it
my
doesn't
god,
need?
and start killing the good bacteria that the child is supposed to use to
Do you
build
understand?
immunity.
Yeah.
Do you understand?
So
That's why you discover that, I mean, some of these children, they later come down with, I mean, simple infections that
Amoxicillin.
normal antibiotics, normal, common antibiotics
to not work
should be able to, take care of. But because they've abused these drugs in the past, so they've developed resistance. I mean, I have seen blood cultures, and then I'm like, wow. You're seeing that. I mean,
everything that they resist.
everything is resistant.
There was a
Probably
time
you hardly get one antibiotic that will be sensitive, and then you not be lucky. Sorry, you not be. I mean, if God will not help you, that particular one that you are sensitive to will be all these very scarce and expensive drugs. I'll be like, now you run out of yourself. Now you run out of yourself. I mean, something that's common and was could have taken care. When you've abused it and then you develop.
There was a time that this was trending on social media. I think it was X, where they did the MCS, the sensitivity for this patient, and what we were just seeing was resistant. I was like, this person may just dig in grave.
And the lab was even kind enough to even test different
exactly, because ideally what is happening now is that, and do you know why it's annoying? I will say this, and I actually mean it, right? I feel like anybody that is abusing antibiotics is wicked. Why did I say the person is wicked? Because most of the times, especially when you've been told time and time again to avoid that, most of the times when you abuse these medications and then these organisms mutate and then form resistance to these drugs, right? If somebody now that has been peacefully using his drugs normally maybe comes in contact with this resistant species, the person will now start suffering what another person caused. Do you understand? So, for example, now, okay, let's even give an example of when we talk about mutation and organisms getting resistance. If you notice that most of these insect repellents, most of them now, when you use them, except say you did just spray them on top of the mosquito, you go spray and finish. you go see mosquito, you go just
I'm telling
use
you, I have
it.
noticed that in recent time actually.
You go dust am off him body.
And then
Then
you
they
start
fly
like
up
this are you
and
bought
down.
fake or what?
So that's why, like, I always say this, that anybody that is doing this thing, that has heard, right, or people that are going to listen to this video now, that will still go ahead to still abuse these medications, right, they're actually not nice people. Do you understand? It doesn't take you much. I know that most people will say, oh, the time that they would have used to come to the hospital, sit down, maybe talk to a doctor, get investigated if they need to, like that, they'll just use it and branch into a pharmacy and pick up medications and go home. I understand that you want to do that, but at the end of the day, at what cost? Do you understand? Because the end is meant to justify whatever means that you used to get to it. Do you understand? So if at the end of the day you branch and cut off all of these things, and then you now create problems for us in the country, how did
some
anybody
patients
gain from
usually
it?
feel that when time they come to the hospital and they run something, they always say nothing is wrong with them. Are you not happy that they're telling you that there's nothing wrong with you? So they always want to go on with a medication. Like if you tell them, oh, you just need to rest, drink water. Maybe if you feel like you're having fever, just take any antibiotics, like maybe paracetamol, hydrate. Some vitamins like vitamin C, just boost your immunity, and take fruits, vegetables. They feel like,
don't be happy.
Are you whining me? Why am I here?
You get one wey dey vex for me one day. She was like, she came to the hospital, so she complained that her child had cough, catarrh, and all of this. So when I did the investigations, it turned out that, like expected, most of the times it's viral, it's a viral infection. So it turned out the result gave a viral picture. And I told the mom that, oh, your daughter has a viral infection, it's self-limiting. I'll just give you an antihistamine to help with the symptoms that the child is having and all of that. The woman was now like, when she went to the pharmacy and found out that she was not given any antibiotic, she now came back to me. I was like, that doctor, that why didn't you give me antibiotics? I'm like, wait, didn't you hear anything I said? Like when we were talking from the beginning. Do you understand? I was like, should I explain to you that this thing is viral? You don't need antibiotics for it. The self-limiting is going to go on its own. Do you understand? She was like, no, that I must give her antibiotics. Now I went ahead to say, that she's going to call my oga. I told her, madam, please call him. Because do you understand? This thing is clear. There is no bacterial anything that is happening here. So why do you want me to give you an antibiotic so that you will now go and use it, and tomorrow when your child now requires to use an antibiotic, this thing will no longer work for us? Do you understand?
So another case is like, maybe a child is stooling and vomiting, and you do a full blood count and doesn't show that it's a bacterial infection, and you just say, okay, what you just need is just rehydration, maybe give a probiotic to repair the gut and zinc, and they will be like, and you keep explaining to them that the most common cause of diarrhea in children is either E. coli or is viral. That is not bacterial.
You don't have antibiotics for them. You are not a good doctor.
Exactly.
The funny thing is that they might start avoiding you like something.
Exactly. They'll say, no, I don't see this.
I don't give antibiotics. Say, don't have it.
And another thing is, for example, now we are going into the dry season. You know that one of the commonest organisms that causes all of these things in the dry season is rotavirus. Right? So now maybe children are coming down with stooling, vomiting, do you understand? And then they come and you do a test and it's viral. Madam, this is what you should do, right? If the child is severely dehydrated, maybe we may need to admit the child, rehydrate, supportive care. Do you understand? But if the child is not dehydrated that much, you can tell the person, WHO has certified ORS as a very good. Do you understand? Because what we are usually scared of when a child is stooling and vomiting is dehydration. Once you are able to avoid, even if it is even bacterial, right? The major thing that you are afraid of in stooling and vomiting is that dehydration. Do you understand? If it's bacterial, you can now decide to give an antibiotic. But if it's viral, it's supportive, rehydrate the child, make sure that the child is okay. Like we had a situation recently. this woman, like, she was very scared because she was like that. How old were those kids again? I can't remember. Right, that they were stooling, vomiting. This. She brought in. I think one of the twin was like very weak and all of that. So she was very scared. So we're now telling her that, madam, you don't need to like be so scared. Do you understand? Because we had already started correcting the deficit that the child had and all of that. So we told her like what we are saying now. And thank God that she is educated, and then she was able to pay us a listening ear. Do you understand? That this thing is majorly the dehydration. And once we rehydrated those children, even though that, after rehydrating, they may still be stooling for a while, you get, but once you're making sure that they are well hydrated, nothing happens. They start playing up and down. Do you understand? So, but when you tell another person now this, maybe that has been indoctrinated with antibiotics, do you understand? They would not listen to you. There's even this funny one that happens now. Okay, I've seen you finish. Oga, madam, you have malaria. Next thing now here is, I'll say, okay, I'm going to send your medications. You go and pick them up in the pharmacy.
You must have antibiotics for them.
Thank you.
Malaria and typhoid.
You get to
treat it together. Oga, are you just treating it together?
I know my body. It's not only malaria.
I dey tell you, it's this I know my body that malaria. It's this one that pains me the most. So the man now got to the pharmacy and was like, this one said when he came, he didn't even like talk about typhoid to me, because when we now finished, I was now like, that you have malaria, or you can't get your medication to the pharmacy. So when he got to the pharmacy and they gave him drugs, he was like, that Oga, not be even. It was like, doctor, that you did not give me antibiotics. I'm like, antibiotics for what? Shey we just finished talking now. It was like, no, now that I thought antibiotics is part of treatment of malaria. I'm like, how? Where do you people hear these things from? Because I don't even, at the end of the day, I blame the fact that, like I said, that's part of the reason why we are doing this thing, so that people will hear more of the truth. Do you understand? Because a lot of people want to just get information from the wrong places. So you hear your neighbor say, they no add antibiotics for you. Wetin they come dey treat you for? Do you understand? And then you now feel like, that doctor doesn't know what the person is doing. And like you said, some of them will now come, they don't want to see you because they now have that impression that, this doctor does not know what the person is doing. Do you understand? But rather, you're the one that is trying to explain to the person very well that this is why you need this is why you don't need this. Because me, I used to tell patients when they are asked, the ones that ask questions, I will tell them that, they'll be like, when they want to ask questions, they'll be like, don't be offended. I'll be like, I'm not offended. It's your right to ask questions. Do you understand? And I'm not scared of your questions because I'm not a quack doctor. And person will not know what they do. Do you understand? But they fear question.
Even if you don't know, you check, right? No, now that's the truth.
This one another topic altogether. Because say there's this thing that happens a lot of times, and I feel like it's important to say this. Right, because there have been times when patients were like, that this doctor, there was this one that was trending one time on social media. The guy had to do an operation for this lady or so. Right, and this thing that happens. Yes, you're a board certified surgeon to do this. Do you understand? But before you do a procedure, you want to like refresh your memory again on it. Do you get? Then the patient, like the doctor was in one of the nursing station and was like reviewing everything, like trying to fact check, get everything. Do you get, so that it's fresh in his head. So the patient was now videoing it and saying that he's scared, that the doctor that wants to do the operation for me is reading. And I'm like, do you people think that you're meant to be happy? Do you understand? There's this thing that one of these things always used to say then that they used to say that you're safer in a doctor that double checks things than somebody that feels like, I know it all in my head, I don't need to check. Especially when you're dealing with children. That's what people don't understand. It is not a bad thing to double check the dosing. Do you understand? Because if you don't give the right dose sometimes, you can pack the person's kidney. Do you understand? So checking is not a bad thing. I feel like this, like, thank God that you raised this up. It is an impression that has to be corrected to Nigerians. It is not everybody that is checking it because they don't have any idea what you're saying. Some of the times they are just trying to double check, be sure that, because
I'm saying
you're
one
not
doctor
a
cannot know
machine.
everything.
Do you
You're not an
understand?
island of
And
knowledge.
sometimes things are updated. For example,
Definitely.
let me give a very good example that a lot of people may not know. Puritin, right? Puritin, there is a new study that came out this year that it is no longer very safe for children that are less than 6 years old. Do you understand? So it's an updated this thing. So you get, so if you're not because medicine is progressive. So medicine is progressive, right? So there are a lot of things that we used to do before that updates have come on, right? And we're still going to touch on things like whiteout test, right?
Why not? I mean, that's always their justification.
Exactly.
Over time, they've actually, some of them, some of them are very educated. They feel like, oh, okay, since this doctor is claiming that, or maybe they already have a feeling that you would not want to treat them for the supposed typhoid. So they would have done it wide as like somewhere else, and then they'll bring it to you and be like, once you are telling them, oh, they don't need antibiotics, they are bringing out their wide as test, and then I have done the test. It's possible.
Anytime they do it outside, it's always
it's always because
it's always showing that
the labs wants they want to make money from them. Exactly. They know that if you keep telling them negative, they will not come around again. So, and the one thing that we want everyone to know is that virus has been ruled out completely. It's not.
It's outdated.
It's outdated. No one uses virus again in testing typhoid.
If you want to know you have typhoid, you have to do a blood or a stool culture.
So now, as regards to this typhoid, right? I feel like Nigerians need to do a lot better, right? And this information, this is part of the reason why we are doing this thing, so that people hear, right, and people know that, oh, this thing is no longer working anymore. For example, now, like the typhoid that we are already talking about, there was a time when we were trying to find out why are these labs still doing typhoid tests. Is it that the lab scientists here don't know that whiteout test is outdated? And when we did a survey and asked some questions, we found out that they were succumbing to the pressure from Nigerians. Do you understand? They feel like, and at the end of the day, if you come insist say you want do whiteout test, no be money you go pay me. You understand? So they'll feel like they'll tell these patients that, oh, this thing is no longer used for typhoid again. And the patient will either go elsewhere or insist that they must do that. I did not pay you money, that you must do the typhoid test for them, the whiteout test, sorry. And then when they do it, they'll give them their results and they'll be good. They'll now come with it and I'll be telling you, doctor, para wetin abi that oh doctor, I have this. And most of the times, once I see that whiteout test, it pisses me off. Like, it just pisses me off. Like like places like where I work now, we don't do it. Because a number of patients have come and say, we don't do whiteout test. I said, no, we don't do it because we are progressing with medicine. Do you understand? It is outdated. It is not sensitive. It is not even specific for typhoid. So,
and the funny thing is that most of all these patients that claim they have typhoid, they don't even have.
They don't have typhoid.
And sometimes when I sit, if I notice that you are reasonable,
if you see a patient that has typhoid, you will not pray.
I feel like they always feel like we're exaggerating this comment.
Every time I see any patient that is very reasonable, I try to like properly educate you and then let you know how typhoid looks like. I mean, in practice, I can count the number of typhoid patients I have seen. I mean, there are very few I have seen.
Exactly.
Most of all these things
not as common as we think.
Do you understand?
Since I've been practicing, right, I feel like it's just one better typhoid, like confirmed typhoid case that I've seen, and that one, it happened very bad. It caused peritonitis at some point for the person. So people don't understand how bad it can be.
You're saying I'm telling
you're saying you have typhoid. You never see typhoid in action. If you see typhoid in action, you will tell yourself that I will not even be mentioned in the same sentence.
Typhoid again. I'm telling you.
Do you understand? So
someone that can perforate your
These are the things that we try to educate people, and when you're saying it, sometimes it looks like you don't know what you're saying. And I also need to make this plea, right? I feel like I don't know whether it is people that are not updating themselves with things that are updating, or maybe the fact that there are still people that
So many practitioners
they are
like
still
enablers.
yes, there are
Yes,
people that are
enable
enabling some
this.
of these
Yeah.
things, and there are still even quacks that
True.
people are seeing and are feeling are doctors. Do you understand? Because if we should not be enabling anybody with a wider test at this point, right?
Yeah,
And saying
we need
that,
to do
oh, that's
better.
what we are going to use to say that you have typhoid or
We need
not.
to do
No,
better.
there are updated guidelines that you can use now for diagnosing a patient with typhoid. Do you understand? So these are the things that we are trying to advocate for and get people to understand. Ciprofloxacin has suffered in the hands of Nigerians because of this typhoid
I wonder
issue.
how we've not developed resistance to that drug.
Honestly, that drug must be very strong.
That drug is stubborn. The fact that that drug is still active, I mean,
It's still active for
it's
some
effective
people
for something.
because the way that it is taken, there are some people self, and the funny thing is that ciprofloxacin is a fluoroquinolone. Do you understand? It is not even. I've seen, like, recently I saw somebody that came and met me, right? Oh, that I've been using this, so I'm not getting better. Do you understand? And the person just had cough and catarrh, and then was having fever and other things, right? Yes, the person had a bacterial infection that was causing the cough and catarrh, but ciprofloxacin is not even first line if you want to
Yeah,
treat an
there's
upper
some
respiratory tract
specific
infection. Do you
yes
understand?
classes of
So why will you
antibiotics.
carry ciprofloxacin and give to a patient for cough and catarrh when there are other things that you can give? These are some of the things that I frown at, right, when I see them. Do you understand? Because I'm like, we should do better when it has to do with at least basic things, common things occur commonly. These are common things that everybody, just like if you dey go exam for school, sabi as they dey treat malaria, na veto, because they will tell you common things occur commonly. Why will you be goofing when it has to do with something like
very
malaria?
basic,
Do you
like
understand?
malaria, yeah.
So these are some of the things too that are also causing these problems for us. Inappropriate dosing, inappropriate prescriptions, like you're giving antibiotics when a patient does not need the antibiotics, or you're not giving the antibiotics that is required. At least there are guidelines when it comes to treatment. For example, if I want to treat a urinary tract infection, now that's where I'll say, okay, let me go to the fluoroquinolones. Do you understand? I get, when I see they do house job, you get one of the times Dr. Misu, him dey come around, they talk say, why are you people doing ceftriaxone for somebody that is having pyelonephritis? Why is it the first thing that you're doing? What happened to the fluoroquinolones? Do you understand? So this, do you get, these are the things that people need to understand, that you don't, inappropriate dosing, underdosing a patient, giving what the patient does not require for this. Like I said, if a patient comes with this, there's something that should be first line first. Do you understand? So these are some of the things that have been predisposing people to have.
To buttress your point about inappropriate dosing, I mean, it's not just using antibiotics anyhow that can cause. There are so many ways antibiotics can develop resistance, like that inappropriate dosing that you said, and this is common with in a pediatric
children
setting.
Yes, exactly,
because most of their drugs are weight based.
Yes,
So we should not do the whole, let me just approximate. I mean, this boy, you look like, how old are you? Then go take 500 milligrams.
And it's funny that most of the time you see a child, it will just, like the other day I saw an 8-month-old or 6-month-old child that was prescribed, I think, ceftriaxone, and they gave the child 5 meals, and most ceftriaxone come at 125 per 5 meals.
Per 5 meals, yeah.
I'm like, you want to kill this child? You want to kill the child, or they're either going too high or too low. So it's very rare for you to see.
Both of them have issues.
Yes, it's very rare for you to see them prescribe an antibiotic or any medication at all for a child with the right dose.
Yeah, so I think it's common with all these roadside.
Exactly, I feel like
that is, and those are places that people patronize.
Yes, patronize.
What they can think of coming to the hospital, oh my God.
And honestly speaking, I feel like federal government has a role to play in some of these things. For example, enforcing the fact that, as basic as it is, a weighing scale should be in every pharmacy. Do you understand? Yes, I know that we are trying to communicate the fact that patients should come to the hospital, but some of them may not still agree. At least we can help to curb some of the effects of this resistance by having as basic as a weighing scale
And
there. Do you get?
Prescribe those per weight.
Exactly, so that
Those per weight for pediatric patients especially.
Exactly, so that if you want to treat a child, the child steps on the weighing scale, you check what the child's weight is, and with that you prescribe the appropriate dosage that the child needs.
If you are abusing the drug, abuse it the right way.
And you should also update yourself too, because I know when we did pharmacology now, at least that's where we learned different classes, what they are for, what class, whether is it bactericidal, is it bacteriostatic, the side effects. Do you know those kind of things? Contraindications of these medications. So there are a lot to, There's a lot to. So when you say you are abusing a drug, it's either you are using antibiotics for diseases or illnesses that do not require antibiotics. They prescribe a drug for you. If you use it first, second day, you feel better. You now decide that you are healed. No longer. So they prescribe an antibiotic for you for 7 days. After the 3rd day, you are fine. Jesus has done it, and you stop the medication.
Yeah, water will shock you.
And anti-malaria. After funny enough, for those parents that bring a child, they said the child is hot and all that. They quickly take to the pharmacy. They get antibiotic. Like I said, a child, they prescribe 7. This is a 1-year-old child. The pharmacy prescribed 7 different medications for few temperature. You know the funny thing, after they did the food blood count, there was nothing in the food blood count. I understand temperature is 38 degrees. Yes, it's alarming, it's shocking. But sometimes it might just be something that is viral or transient, acute febrile illness.
Most of our respiratory tract infection are viral. They don't even need antibiotics.
Funny enough,
supportive care, the child will be fine.
Funny enough, I think I should also say this because I think that fever is always like scaring people. And before I forget, there's something I need to talk about. I feel like a lot of Nigerians don't know what fever is, because I've seen this thing happen. I've seen this thing happen back to back. Somebody will come to the consulting room and he's saying, "I have fever." And I'll just be like, humor me, what is fever? Right? And the person doesn't know what it is. The person will start telling you, oh, it's when I'm feeling weak, it's when I'm feeling tired, it's when I'm having headache. And I'm like, how? Or they will say that fever is malaria. And I'm like, how? Like, I've seen it happen back to back. I'll now have to start telling them that fever is not this. So fever is when your body temperature has gone beyond what the normal should be. Now try to explain to them that there is low grade fever, there is high grade fever. High grade fever does not start until after 38.5 degrees Celsius. So anything that you're having from 37.6 to 38.5 is still within those. So that 38 itself should not even, and I always try to encourage patients that be parents that if you have young children in your house, get a thermometer. Do you understand? So that when you're coming to the hospital, you can be able to tell the doctor, oh, I checked too, and what I got was this. It is very informative, and it actually helps the doctor attend to you better.
That's very, very important, especially with neonate and infant. A lot of times, especially first timers, I got all these first timer like mothers. They come, you probably discharge them after the normal postpartum care and all, and then they are back after like a week that the child is running fever, and then you check the temperature is fine. Most times it's got that they cover the children too much, like this baby is too much. It's just like over
that overzealous covering.
Put on the normal clothes, put on one big overall, so is adding to it, mosquito nets. Cover. I mean, even you as an adult, if they cover you like this, won't you have fever? And then you want us to start, pricking this child for no reason, just, So these are things that we want people to understand that, it's not all fever that necessarily means the child has infection or the child needs an antibiotic. So, and these children they're more vulnerable than adults. When your child has a fever, if you have an antipyretic and you know the appropriate way to use an antipyretic, and then probably it's midnight or you're far from the hospital, you can administer an antibiotic.
Expose and tepid sponge.
Tepid sponge.
Antibiotic, things like paracetamol, syrup.
And don't overdose it. Don't abuse it. So if you've done that and it's not getting better, then the next thing is you come to the hospital, not to go and buy antibiotics.
Not to go and buy antibiotics and buy anti-malaria.
People that did anti-malaria and antibiotics, they named it like that because anti-malaria is specifically for a malaria that has been tested positive. Antibiotics and infection, a bacterial infection in particular that has been tested, like it's been confirmed that you have a bacterial infection. That is when you need an antibiotic. So it's not all fever that requires anti-malaria, and it's not all malaria that needs a simultaneous antibiotics. Please.
I don't feel like because there was a time I came to the hospital after discussing with the doctor and they prescribed antibiotics for me even before we saw the result, like maybe an MCS, and you just feel I can. There's sometimes that's why it's called history taking. We take there's some histories, like some discussions we have, and the doctor thinks this is looking like you have a urinary tract infection, so I'm going to start you on some prophylaxis while we wait for the results. But there are sometimes they will tell you go and do it, even if it takes 3 days, come back. There's a reason why they allowed you to go home without any medications at all and still come back for the result of the test. So
there are indications for all this.
So ideally, if you want to do like if you want to treat somebody for a UTI, or you're thinking that this patient has a UTI, like I always try to explain to my patients that there is a guideline for these things, right? So we take your sample, right? In medicine, there's first line, there's what you can start broad spectrum antibiotics, right? So after we have taken your sample, just to buttress what you said, after your sample has been taken, we can place you on broad spectrum antibiotics pending.
Wait for your sensitivity.
Yes, when the sensitivity comes out. The reason why sensitivity is very important most of the times is because of this resistance we talk about. Because if you don't go abuse all of these things, you don't abuse them, and then maybe the organism that is causing your problem now they fear any of these drugs.
Like
exactly. Or like it's not even afraid of the first line fluoroquinolones anymore. Do you understand? So we now have to do sensitivity. We now find out the one that is sensitive to and now be able to use it. And this thing that we keep talking about, and why this thing is very important, is because it saves you money. Right? And it saves you having to deal with something for longer than you should have dealt with it. Do you understand? Why it saves you money is because, like I was saying earlier, if for example now you do a sensitivity test and all the basic cheaper antibiotics that you can use, you're resistant to them, we'll now start looking for big guys.
I'm
telling you, and those ones are very expensive. You now see yourself, patient will now be asking me, why do I have to buy this medication that is 20-something thousand just to treat to them what they are calling leave it now.
No, because you are doing what I was and you have to buy the one that is 20,000.
If you leave it, you will see what infection can do. So these things are actually very important. The way we are saying it and we are laughing about it, it's actually very, very, very important that people begin to take some of these things that we are saying seriously. Stop abusing drugs. Like she said, it's very common in especially flagyl. Right? The fact that somebody will just take 1, 2, and maybe because the stooling has stopped, you will not complete your dosage. And also this thing, I think I made a video about it at some point, right? The fact that people will always feel like flagyl is starter pack for diarrhea, for stooling, right? It is very wrong. So flagyl should only be used if it has been confirmed that you're having a bacterial infection. It's not something that you should use anytime you're having diarrhea. And when your flagyl is prescribed for you, you have to complete the dosing. Don't be among these people that will just take 1 tablet, 2 tablets, and after that you abandon it. Before we'll lose out on the benefits that we can get from
Get from
flagyl.
flagyl,
And let me
yeah.
explain something that happens, right? If you don't have a bacterial infection and you go ahead and use flagyl at that point, what you're doing is that you're altering your gut flora, right? Because there's what we call the good bacteria that is in your gut. So
Yes.
if you don't have a bacterial infection and you go and start using flagyl, you can go and kill off those ones, right? And then you'll now be coming down with things that you should not have, like things like clostridium now, where usually it comes in maybe if the person has a weakened immunity, or maybe the person is, the gut flora has been tampered with. Do you understand? So these are the reasons why we say this type of things. And clostridium is not something that you want to have, because that one is actually very, very offensive. It can keep you in the hospital for a very long time.
It's even, especially this clostridium deficit. Most of his cases are following, abuse of antibiotics, commonly with clindamycin and some other antibiotics. So I mean, these are things that are actually preventable.
Yes, exactly.
Just don't abuse these antibiotics. As much as they can be therapeutic, they are very good. I mean, but they are meant to be used when necessary, not to just, you just feel like taking antibiotics because you feel like your body is getting warm. It's not paracetamol. So don't turn into paracetamol or vitamin C. Even paracetamol, something as basic as paracetamol, it has, I mean, you can abuse, you can have an overdose of paracetamol, which can actually damage your liver.
Exactly.
So if something as simple as paracetamol that has a wide therapeutic window can be like that, not to talk of,
I've seen somebody that had issues from paracetamol that affected the person's liver. So there was this guy that he came to the hospital. You know, all these people that do annual health screenings and the rest of them. So he came and there was his liver function test was looking very funny, right? And by the time I started to ask questions, I asked him, is there any medication that he's using at the moment? He was like, oh, that he works, he's all these people that work onshore and offshore, right? So he says that every single time that he's onshore, or in fact for I think about the stretch of 3 months, he was using Sudarex morning, afternoon and night. Like
food.
Like morning, afternoon and night, and it began to affect his liver. Do you understand? So I had to tell him that, Oga, this thing that you're doing is the problem that is causing all of these things for you. So sometimes these are the things that when you try to tell patients that they should avoid, they don't listen to you, and at the end of the day they end up in this type of dicey situations. Even people that, for example, now when it has to do with malaria treatment, we're beginning to have a lot of difficulty with treating malaria. Do you understand? Somebody will come, basic malaria, you give oral medications that should have taken care of it comfortably, but you now see the person will come back, you will now say, okay, let's try injectables. You now do injectables, the person will still go and come back again. You now have to admit the person. There was a funny situation that we had one of the days, right, where even as far as artesunate
wasn't working. Can you imagine?
And we had done all the possible screenings to make sure that we were not dealing with any other thing.
That it was malaria,
it was resistant malaria where they worried this person. And what we now had to do, we now had to go back to olden days religion. We now had to go to quinine. It was actually quinine that we gave this lady and she got better.
Quinine is actually for treatment of it.
Yeah, I know. Like I'm saying, but you know that nowadays it has been phased out by these newer medications. Do you understand? But because of the way these medications have been abused over time, like you now see yourself having to go back to these medications to be able to get the results that you need.
Actually, if not for abuse of medication, we shouldn't have any malaria that cannot be addressed by artesunate.
Exactly.
But because sometimes malaria that is, I mean, that normal oral ACT people have handled, you just, you hear patients say, I don't take tablets. It has to be injection.
Exactly.
Some of our colleagues too, they don't help matters. They succumb to this pressure.
The pressure from patients.
They have a feeling that, as far, or if they don't give it, patient will feel like they're not good doctors per se, or maybe a private hospital where they feel like patients are paying, so patient has the right to
To
demand.
demand what they
The
want.
patient does not have the right to demand for what they want. You are the doctor. You've listened to the patient's complaint. You've done your due diligence by running tests. You should give based on your clinical judgment, this is what you need. It is even fine to, if you don't say anything, it's fine to tell the patient, oh, there's nothing wrong
There's
with you,
nothing
madam.
wrong with you.
Just need to
Yes.
rest.
Go home and
And you'll be
rest.
fine. I mean, it doesn't make you a bad doctor. So these are things that we get to see every day. Same thing with antibiotic resistance. I mean, I've seen people just give antibiotics with antimalarial drug without full block count is fine. I mean, you're not seeing any classical any need for antibiotics. Why are you giving antibiotics?
There was even, I always used to tell people the story that, oh, that I've not treated malaria for like 2 years now. The last time was like in 2023 October. Anytime I tell patients this story, they'll be like, that what are you doing? It's because you're a doctor. And I'm like, is there a different blood that is running through my veins because I'm a
Maybe
doctor?
they use your serum to make vaccines.
Same with me. I treat malaria like once in a year or two.
I left that group chat.
But ideally, that's actually how it's meant to be, because
Because your immunity is
yes, do you
fine.
understand?
Yeah.
And apart from that, we are in a malaria endemic area, so the parasite that causes malaria should not really cause you so much issues like somebody that is coming from Obodo Ibo. Do you understand? So a lot of the times, there's always this thing that happens. Lagos is a stressful place, right? And most of the time you're stressed from work, maybe you start having these headaches, do you understand? And before you know it, oh, you will now branch to the pharmacy on your way home. And once you just tell them, I have headache, do you understand? Or I'm feeling feverish, right? And like I explained earlier, a lot of patients don't know what that means. Do you understand? Once you just tell them, they will pack anti-malarial antibiotics and give you, and you will go and start taking it. And most of the times, have I had headaches? Yes. Have I felt tired? Yes. I'm working. Do you understand? Have I felt body pain? Yes. Do you understand? But I understand that this thing is work stress. By the time I maybe on my off days, I rest well, I feel better. Do you understand? So when this guy is always saying drink water and rest, people will think that it's just cruise. Most of the times, you just need to hydrate yourself very well and rest, and you'll be fine. And sleep. Do you get? Because there are a lot of things that can cause headaches for you. If you're not sleeping well, you will have headaches. Do you understand? If you're stressed from work, you have headaches. So it is not every headache that is malaria. Do you understand? And it is not every cough. We need to, if it's possible, to actually carry an inscription and inscribe everywhere that people go to so that they can see it. It is not every cough and catarrh that requires antibiotics. It is not every stooling, even vomiting, that requires antibiotics. There are more
every skin infection too.
Exactly. This is another thing. It's not every skin infection. Most of them, I'm telling you, most of them either fungal infections, or I don't see person way that drank. And my problem is that you go today, they will give you this class of antibiotics. You take it, it will not work. You go back maybe to the same pharmacy or to another one, they will give you another class of antibiotics. You start drinking it, and it will not bother you to say, omo, this thing wey dey do me like this, let me even come to the hospital and figure out. At some point, maybe after they have tried 1, 2, 3 times and nothing is working, they will now carry themselves to the hospital. I've seen a lot of cases where somebody was taking antibiotics for scabies.
True. This woman,
do you understand? Scabies that
like branded Augmentin and branded Xanax for scabies.
And when you're trying to explain, I'll tell them that
actually I actually want to. She actually took Rocephin for scabies. She did not even take the unbranded. He went to take Rocephin.
I used to tell them that this money now that you used to go and waste on this thing, if you had come here earlier, that money maybe if you don't use and buy shawarma, or buy ice cream.
Enjoy,
Enjoy yourself,
Go
but your
cinema.
boss will find it to pay for something that you did not need.
Yes, and you go see attack your normal flora.
Exactly.
Flora will just be begging you not to
Just
do
begging you, not
it.
So I now told this woman that this thing that you have is scabies. You've been passing through hell for this number of times because of lack of proper diagnosis and lack of doing the right thing. If you had come here since, I would have told you this thing was scabies. And by the time she used our very good old benzoate,
So it's or pomegranate cream.
do you understand? She was fine. So these are the issues. These are the reasons why we raise some of these things and say, if you have an issue, I don't know why we'll go to, there's that picture one time that was trending. If you have a health problem, you first of all go to your neighbor, ask questions, maybe go to the church, go to this other place before you now finally
use
come to the hospital. Yes, use herbs. Me, I'm a child of God. I believe in the efficacy of God doing miracles. You understand? But there's something that Apostle Emmanuel Aaron said one time. He said something that I think it was last week Sunday's message. It was not him, it was Pastor Laju that said this. She said, but it was under the topic that we were talking about. She said something about understanding that yes, in the healing power that God that has allowed medicine. Do you understand? You should be able to understand that God can also heal you through medicine. Do you understand? Because the person that has given the wisdom to understand these things, develop these things, is still God. Do you understand? And you can get better taking your medications. Do you understand? So don't always feel like, oh, and the doctors are the enemies. Do you understand? When they give testimony, they will say, what the doctor said that, oh, I cannot do this, I cannot do that. But if you come to the hospital many of the times, you actually see that some of the things that you spend your money on, you don't actually need them. Do you understand? And the number of times, I will say this thing because it's important. Most of the times, it is not every time that, for example, let me give this example. There was a patient that we saw one certain time, right? Stooling and vomiting. We just wanted to try something, right? We did MP. It was scanty. And funny enough, throughout these years that I've not treated malaria. Do you understand? I've been seeing scanty malaria parasite. But there's something that people need to understand, right? You're in a malaria endemic area, right? So most of the times there is a likelihood that you can have scanty. Do you understand? When you do a test, but it does not mean that it is. Otherwise, almost every month or every 2 months, you'll be treating malaria. Do you understand? So people also need to understand this, that it is still within the discretion of the doctor to be able to say, okay, oh, this, but this is what is wrong with you. Do you understand? This is what I'm going to treat you for at this point in time, so that at the end of the day, we don't keep using medications. I don't even like taking drugs. I use drugs. I used to tell my patients that I'm not a fan of drugs. I only tell you that I'll only give you drugs when I know that you need to use the drug. If you don't need to use the drug, like Dr. City said, go home, rest, you'll be fine. Do you understand? So these are the things that we need people to understand. And if you understand it, you will help us reduce the problems that you're piling for us in the medical sector. Because most of the times when you're coming with resistant variants of things, for example, you're coming with resistant malaria, and because resistant malaria, they know the right term for person head. If you come now and you're having symptoms that look like malaria symptoms, and maybe we run the test and see maybe 1+ or this, right? And the normal thing that any doctor will give, especially if you can tolerate orally, is to give you oral medications. Do you understand? But by the time now, because maybe what has affected you is a resistant species, do you understand? You will now still find yourself coming back to the hospital. And you coming back to the hospital, most of the times when patients don't understand that, oh, there's resistance, so they will now feel like, oh, that doctor did not treat me well. Do you understand? Or maybe because he did not give me antibiotics, it did not work very well. But it is just resistant malaria that you're having because of these things that we are talking about. Do you understand? So I feel like people should come to the point where they listen to the things that we say and avoid the things that we ask to avoid. So like we have already talked about, we talked about underdosing. Please, federal government, if una go see this video, please, it will be good, because I always tell people that if I become minister of health, a lot of things go change. Wallahi, I'm not even joking. A lot of things are going to change. Things as little as this are the things that actually affect most of these things.
Yeah.
They should have weighing scales in pharmacies. Do you
Yeah,
understand
every
that
pharmacy should.
everybody can, any child can hop on and you get the right weight and dispense drugs appropriately? Do you understand? You should also make sure that medications, like every hospital should actually have a team that actually checkmates some of these things. Do you understand? To make sure that you're not over prescribing antibiotics that are not required. Do you understand? And making sure that people are only giving antibiotics when they need it. Do you understand? And then also another reason why we are doing this, making this video, is to sensitize the people, so that if you go to the hospital and a doctor is telling you that, madam, for this condition you're having, you don't need an antibiotics, please listen to the person, because that person is actually doing you a favor and is doing the entire population of this country a huge favor. Do you get? So these are some of the things that we are trying to outline today, so that people will know the right thing to do and stick to them.
Antibiotic no be vitamin C, no be candy.
And anti-malaria no be supplement, no be wetin person dey take every day.
So please, all of these things that I've talked about today is for your own benefit. And like they said, antibiotics are not vitamin C's. Anti-malaria are not supplements, for those of you that like taking it every time that you come to the hospital. So if you see my face consulting you, just know that if you don't need antibiotic, I no go give you.
It's like call me, say I don't be good doctor.
I swear.
I'm helping you.
And to all the doctors that are out there, please, let's stand our ground. Let's not succumb to the pressure that comes from patients telling you that, oh, you must do this for me. It is within your right to tell them that, no, this is what you need, this is what you don't need. There was this patient that I was attending to the other day. I tell her, I'm saying, go use this medication for 5 days. It tell him go where they want give am the drug for HMO office. They talk say him go use am only 3 days. They can't call me. When they tell me that the patient said that he's going to use it for 3 days, I'm like, is it the patient that is treating the person? I don't understand. Do you get? So please, let's stick to these things that I've said, and we are going to find out that we are going to cut down on some of these issues that we are beginning to have in the country. Also, let me end with this, right? If you want to treat somebody for malaria and you want to do injections, please, to my doctors that are out there is no guideline that says you can do start dose of injection, right? If you want to do injection, you do injection. If you want to do tablets, you do tablet. There's nothing like, patients have met me many of the times and be like, can you give me start dose of injection, or give me one injection today? And then I used to tell them, if you want to do injection, you do injection. If you want to do tablet, you do tablet. You understand? So please, let's do this, and everybody stay safe, and we'll see you on the next episode of Health Talk We Make Sense. Thank you very much for your time.